ladies and gentlemen, my name is Dr. Terry Chan. I'm a chiropractor with Spinecare Chiropractic in Penang. Just a little bit about myself. I am actually born in Penang and I went to school in Penang. Went to high school in Penang Free School. Halfway through, I transferred high school to New Zealand, and after high school, I actually enrolled in a health science course at the University of Otago. It is during this period where I start to develop an interest in anatomy, specifically in the field of spine and also in diagnosing conditions about the spine, and then that's also when I discovered chiropractic. Then subsequently I obtained a bachelor's degree from the prestigious New Zealand College of Chiropractic. I graduated at the end of 2010, so I started working in 2011. So now it's 2019. I have been working for almost 9 years, and in that time period I think I've treated over 10,000 new patients. In terms of working experience, I actually had some experience in Kuala Lumpur and also working in Australia before I decided to come back to Penang. And I am a chiropractor that have a keen interest in the treatment and management of scoliosis cases. I'm actually certified in scoliosis bracing and also scoliosis exercise rehabilitation. Now, enough about me. Today we are going to talk about the treatment and the management of scoliosis cases. Before we begin, just a little acknowledgement. At Spinecare, we actually do partner with a company called Scoliosis, and they are an international company that actually specializes in treating scoliosis cases, and they have kindly provided permission for this presentation today. And special thanks are given to the patients who have voluntarily allowed us to use their cases for education purposes and research. Now, the early and accurate detection of scoliosis often will lead to the appropriate treatment. This can oftentimes be the difference between a fused spine where they have to undergo surgery like this, you can see all the screws here, versus a spine where you don't have to do any surgery. Even in adults, the earlier the appropriate treatment is given, obviously the outcome will be better. Now here we see three different pictures. Actually, in scoliosis there are many different kinds of scoliosis, and here you can see the three different types. What do you see here? On the left is the scoliosis of a young 11-year-old girl, and you can see this curve is quite severe, it's about 50 degrees. Technically, this is a surgical case already, and this is a very severe type of scoliosis, especially for a young girl. She's only 11 years old. For a young girl, there's a very high risk that this scoliosis will get worse and progress. So she is not actually suitable for any manual therapy or physiotherapy or exercise alone. She actually needs a good scoliosis brace or even surgery, especially when the curve is already at 50 degrees already. In the middle picture here is scoliosis in an 80-year-old elderly woman. She has osteoporosis, and you can see the spine, especially around L3 and L4, is kind of like shifted to the side, and this is a typical feature in her spine where you have a lot of wear and tear. In medical terms, we call this a degeneration. Her spine is very unstable and it has a lot of degeneration. This kind of spine actually needs a little bit of basically it needs scaffolding, like something to stabilize it from the outside, you know, like wearing a scoliosis brace, or from the inside where you need the rods and the screws to stabilize her spine to keep it under, basically keep it under control. But the thing is, there could be some potential issues with surgery. For example, just general surgical complications that can arise because of the age of this patient. And also you need to think about the reduced mobility in the elderly patient. Plus this patient actually has osteoporosis, so that can be a limiting factor when you want to attach the screws and allowing the screws to actually hold on to the spine. On the far right corner here is a middle-aged woman. She actually went to see her doctor because she had quite a severe chronic low back pain which stopped her from working. She has been having this scoliosis since she was a teenager, and here in this case she has a chance of pain relief from the more traditional treatments such as like manipulation by chiropractor or physiotherapy, but actually her relief is likely to be temporary. Any scoliosis specific rehabilitation may help to improve her posture and give her more long-term relief. Sometimes bracing could be considered for these kind of cases, but it can be just short-term to realign the patient's posture. Typically, surgery is not required in this case unless her curve is very unstable or is actually progressing and getting worse. So you see here is different kinds of scoliosis in 3 different patients, and it's not a one size fits all. Normally a doctor needs to be trained properly to handle the different cases of scoliosis. If we look at this slide here, this patient only have a 14-degree curve, so relatively minor, right? If you are a doctor, you might be asking yourself what questions you need to be answered, that needs to be answered when you want to assess this kind of case. This girl case history is she is a 13-year-old girl. She came to see the doctor without any pain, but the parents detected a small curve in the spine. Actually, what you can't see here is actually her pelvis. So it's important to see someone that knows what they're doing, because in this case they took the x-ray, right? They cut off the pelvis, so you cannot see some critical important information. In this case, you cannot see how mature the girl is, how mature her skeleton is. So the doctor incorrectly thought that her spine is actually mature. She thought that it's a reserve 5. In medical terms, it means that the bone is already mature, but when the bone is mature, then the risk of progression is not very high. However, actually they make an error. Now in this case, there is no family history of scoliosis, so the doctor told her that it's a minor problem, ask them to go home and then come back in 1 year. So the question is, would you expect this scoliosis case to get worse? Let's find out. This is the same girl about 1 year later, and you can see big progression from 14 degrees previously. Now the scoliosis is 43 degrees. There is a big increase in the scoliosis. So what did the doctor actually miss? As I mentioned before, first thing is we want to take an x-ray where you can actually see the maturity of the skeleton, and you can only see it when you did not chop off the pelvis of the girl. Actually, you can see here a little bit, you can see this faint line over here. So in medical terms, she is around reserve 3 or reserve 4. She is not reserve 5. So actually, 1 year previously, she was reserve 0, and her skeleton is not mature at all. So which means high risk of progression. Another thing to consider is that she has abnormal shaped bone here. So this shows that the patient have a very high risk that the scoliosis will get worse. This patient ended up having surgery because the wrong advice was given, and actually what should be done is she should have been treated with a scoliosis brace from the beginning rather than having to wait 1 year. So as you can see, early detection is very important because it will lead to better treatment outcomes, and it's important also to see a doctor that knows how to properly deal with scoliosis cases. Scoliosis is actually quite a common condition, especially in Asian populations, but it is under-recognized. In children, it only happens between 0.3 to 0.5% of the population, and then in the children, teenagers aged between around 18 years and above is only about 2 to 4%, and then adults 40 years old around 9%, 60 years old around 30%, and 90 years old over about 50%. So half of the 90-year-old population is having scoliosis. So most people actually do not realize that the population with the biggest proportion of scoliosis actually is in adults. And did you know that actually a normal adult can also develop scoliosis in later life? This is a case of a 50-year-old lady that went to see her doctor because she had minor low back pain. She had no scoliosis initially, and due to the wear and tear of her spine and the degeneration, you can see 5 years later she has developed what we call adult degenerative scoliosis. You can see that there is rotation in her bone here. This is around L3, and the bone has sort of like migrated slightly to the shifted to the right side. Actually, when treating these kind of cases, you can have clues even on the old x-ray when she's 50 years old. Can you see that one of her pelvis is actually higher than the other? So there is a bit of an imbalance already. This is partially due to, you know, her legs, one leg being higher, so one leg is longer than the other. So if we were to treat this early on and manage this person, probably she will have a better outcome and the scoliosis might slow down or not develop so fast and so serious. In older adults, for example, this is a 70-year-old plus patient. She has a pre-existing scoliosis of about 26 degrees in July 2011, and then fast forward 1 year and you can see from 26 degrees it has shot up to 45 degrees. So in an unstable spine in an adult, right, actually the scoliosis can actually progress quite rapidly, and this can cause a significant impact in the patient's quality of life, as we can see in her x-rays. Some people think that scoliosis is just a curve only, that it does not cause any pain. But actually it is a misconception that scoliosis does not cause any pain. In adults, chronic low back pain is quite common, especially in patients where the scoliosis is in the lower back. And then in the children, right, mild pain is often associated with scoliosis, particularly where the high point, the point of the spine that bends the most. That's when they get pain in the children. Now, bracing has been shown to be effective in stopping and slowing the progression of adult scoliosis in most cases. So here we have a research article. This is published in the year 2011 by the Hospital for Special Surgery in New York. And basically what they say is that in scoliosis patients, they normally present with back pain, and the indications for treating the scoliosis includes pain and also like neurological symptoms, so they have nerve problems lah. Part of the non-operative treatment includes the use of spinal orthotics. That means using scoliosis bracing to treat the scoliosis. They go on and add that, you know, operation should only be considered after careful evaluation of multiple factors and looking at the multiple risks and benefits. Because the thing is, for adult population, the chances of complications during and after surgery is quite substantial. The primary goal for surgery is actually to provide pain relief. So if we can provide pain relief without having to use surgery, wouldn't that be better? And this article here, published in 2016, basically monitors a group of adults with scoliosis for over a 15-year period, and what they find is that for the first 10 years, right, they did not treat the adult people with scoliosis. They did not do any treatment at all, and they find that per year all these adults, their scoliosis actually get worse by 2 degrees every year. So that means in 10 years the scoliosis of the adults get worse on average 20 degrees. Then after that they decided to start treating the adults, and for the next 5 years they put them in a brace, and during this time their scoliosis during wearing the brace only increased by 0.2 degrees per year. This suggests that bracing can be helpful treatment to slow down or even stop the progression of the scoliosis in adults. So we see here, this is the case of a 94-year-old lady. She has no scoliosis up until her 90s, and she started to develop chronic low back pain about 2 years ago, and she also has spinal stenosis. Basically, she had back pain and she is very limited in her ability to walk. She cannot walk very far before her legs become very weak, and she had pain in the legs, and she had to stop and sit down to relieve her symptoms. Also note, you see the posture on the right hand side where she is like hunchback and she is actually leaning forward. In adults with this, what we call the degenerative scoliosis, this leaning forward posture is thought to be the key factor in causing pain. And then we can also see a major shift in her posture on the frontal picture as well. If we look at her x-ray, right, actually her spine is shifted to the left by 48 millimeters. Anything greater than 40 millimeters is considered to have a major impact on the patient's quality of life. You look at this x-ray, if you look at her butt here at the bottom, right, normally if you draw a straight line, the neck should be around up here. But you can see in this case, from the buttock, you draw a line up, the neck is about 132 millimeters in front. And this is highly predictive of chronic lower back pain and also disability in the patient. This patient's doctor actually went on to prescribe a scoliosis brace for her. Now, when it comes to scoliosis brace, right, one of the most common patients that patients will ask us is it comfortable wearing the brace? Does the patient have pain when wear the brace? Is it comfortable? Is the patient able to like move around freely while wearing the brace? Actually, once you get used to it, it's quite comfortable. I will show you this video of this patient.
No?
Mm-hmm.
Yes.
Come on up.
Like you can sit up. Yeah.
Perfect. Okay. So now you can stand up. Beautiful. And then now just turn to face him. Perfect. And then now you can sit down again. Super. And then now let's have you lay down. Excellent.
So as you can see from the video, right, even a 94-year-old patient can easily move around and lay down and get up by herself. Even on the first day she was wearing the brace. So patients don't have to worry about the brace not being comfortable. Most importantly, you can see the postural changes. Before she wear the brace, she's hunched forward. Now she is able to stand straight on her own. Even the frontal plane, you can see the posture is much more straighter and more balanced and symmetrical. Most importantly, she actually achieved a major change in the posture. And what happens is, immediately her pain started to reduce, and within 1 month she was able to walk at least 400 to 500 meters without having the need to stop because of the pain in the legs. This is actually quite a huge improvement and good for the quality of life for a 94-year-old patient. Now, it is also quite a common misconception that there is no back pain when it comes to scoliosis for children. So this scientific paper was published in 2016 in the journal Spine. It's quite a how to say, a reputable journal. And what they did was they monitored 500 patients, and what they find was, of the patients, 68% actually have pain, and spinal pain intensity was positively associated with scoliosis severity. So the more severe the scoliosis, then the more severe the pain. And they also find that spinal bracing was associated with lower spinal pain intensity. So those that are treated with scoliosis braces have lower levels of pain. In conclusion, they say that spinal pain is common among patients with AIS, which means scoliosis. Now, the other thing is, high quality studies have shown that treatment without operation, such as like scoliosis bracing or even scoliosis specific exercises, this can help to reduce the number of scoliosis patients that progress and get more serious and have to undergo surgery. But for it to be effective, right, these treatments needs to be applied to the curve when the curve is small before the patient becomes mature. This places emphasis on the need for earlier detection of scoliosis. So, like if there are any kindergarten teachers or primary school teachers or even parents, if you deal with kids and you want us to come to your place to organize a scoliosis screening session, please talk to us and see where we can do something to help the kids detect if there is scoliosis. Because if there is scoliosis, then the chances of early treatment is better, and this will often lead to better outcomes. Normally, one of the common ways to check for scoliosis is using a method called the forward bend Adams test. Later I will show you an example, and we also use a tool called a scoliometer. So this Scoliosis Research Society, right, actually what they recommend is for females, right, to be screened twice between the age of like 10 to 12 years old to capture the variation in their maturity, and for male children screen between 13 to 14 years old and screen once. So in terms of scoliosis screening, right, when you have a true scoliosis, you have this rotation, and that most of the time will sort of deform the rib cage. So one of the tests that used to be done and still currently being done actually is what we call the forward bend Adams test. So you, from the behind, you ask the patient to bend forward with their legs straight, the fingers try to reach the floor, and then you can look this at the rib cage. Normally there's a hump, like a camel like that. You can see a bit of a hump in the mid back of the patient. But this method might not be super accurate, because if you have a scoliosis in the lower back here, right, this method is not so accurate in detecting that scoliosis. So for example, at Spinecare, in addition to the forward bend Adams test, we use a tool called the scoliometer, and basically you place it behind the spine and ask the patient to bend forward, and if you see a reading of more than 5 degrees, it's a positive finding. They may have scoliosis and they may need x-rays. In the lower back, a scoliometer can also help to increase the accuracy of detection. So anything above 4 degrees is a positive finding. Now for doctors and for parents, what I'm going to go through with you now is some ways to try to identify if there is scoliosis in your child or in your patient. So the first method is you look at the shoulder. Do they have uneven shoulders, like one shoulder higher than the other? The second one is, can you see the shoulder blade, like one shoulder blade is higher than the other or more prominent than the other? The third one is if the spine is actually quite curved, right? Sometimes it's quite obvious when you can see. And the fourth one is look at the hips. Is it uneven or not? For example, you can see the underwear of this patient, right? One is higher than the other. Number 5, look at the waist. See, for example, this case is straight here, and then on the right hand side you can see there's a fold in the skin there. So this is also a big clue. To do the forward bend Adams test, all you need to do is get the patient to stand straight, knees locked, and then dangle their arms in front, fingers pointing down, try to reach the floor, and you'll see got any hump in the rib or not. If there's a bump here, then you know that there's a high chance this patient have scoliosis. In the lower back, it's a little bit harder to detect the bump, but sometimes you can still see it. If you are not sure, always you can feel free to contact us to get a second opinion. Now have a look at these 3 pictures here. As the curve develops, the posture becomes altered according to the pattern of the curve. So if you look at these 3 patients here, different patients, what do you think the curve is? Do you think they have the same curve? Actually, on the left hand side, this person has what we call a thoracolumbar curve. So thoracolumbar is this region. On the right, this patient has a thoracic curve. It's a little bit higher, the curve. And the person in the middle, although she looked like she has the best posture among all 3, actually she has the worst scoliosis. She has a double curve. So curve at the top, and then another curve the other direction at the bottom. The curve on the left is 33 degrees, the curve on the right is 51 degrees, and the curve in the middle is 72 degrees. The thing is, when you have a double curve, right, it kind of balance out, so the posture looks more straight, but actually when you x-ray this patient, the scoliosis is more severe. So it's very important sometimes to take an x-ray to have an accurate diagnosis of the patient. Another common type of curve we see is like this. So there's a curve in the spine, but actually there is no rotation in the spine. So this is what we call postural scoliosis. It's not a true scoliosis. When this patient bend forward, right, during the forward bend Adams test, you actually will not see the bump, the rib hump in the patient, because this is not a true scoliosis. It's not a structural deformity of the spine. There's no deformity in the bones. It's more of a postural problem. So sometimes these cases can be very easily treated with spinal manipulations and specific scoliosis exercises. This is not a true scoliosis, and this is actually a very easily treated condition, this postural scoliosis. Sometimes scoliosis can be associated with some other underlying serious conditions. Most of the time, scoliosis is curved to the right hand side in the upper mid back, and then it curves in the left hand side in the lower back. In rare cases, you can see that there is a primary left curve in the upper back, and then in the lower back you have a right curve. This kind of scoliosis is more rare and more associated with serious disease, so it's a red flag. Another thing is, acute pain is not common in scoliosis with teenagers, and they shouldn't have pain at night also. Also, scoliosis is a condition that is more common in girls. So if scoliosis in boys is less common, and also more often associated with a serious condition. The other thing is, for scoliosis, right, the earlier the onset, that means the earlier the child, like like a baby or a juvenile, very young child, the earlier you have the scoliosis, then the more serious that they have a underlying serious condition and more urgent treatment is needed. Obviously, if you have doubts, sometimes in addition to the x-ray, you also need to MRI the patient. So this is a MRI of a boy, and what do we see here? One of the most common actually diseases can be seen on this MRI. You can see that this white color picture here, this is actually fluid in the spinal cord. This is a condition called syringomyelia, SYRINGOMYELIA. Another condition that you can see in this person is what we call Arnold-Chiari malformation. Basically, it's a rare condition where the bones of the head, the skull, didn't close properly, and then you have a part of the brain, the part of the brain is like leaking, like protruding out from the skull or like that. So this is actually quite a serious condition and needs to be detected early and treated as soon as possible. Otherwise, it can lead to very poor outcomes. This boy can be paralyzed. In this case, the boy was diagnosed late, and they have to do a surgical decompression on his skull and the upper part of his spine. This is the boy, obviously after surgery. So when treating scoliosis, although very rare, sometimes you can come across this kind of cases. It's important to understand the type of scoliosis treatment and the type of cases that you see, especially when you suspect that there are red flags, any underlying diseases that needs to be discovered. So if you just have someone that is treating the scoliosis blindly without understanding the condition thoroughly, it is not actually in the patient's best interest. If you talk about scoliosis, actually, right, we talk about deformity. The spine is deformed. The scoliosis that does not deform is the postural scoliosis that I mentioned before. Actually, that is not a true scoliosis and very easily treated. But if it's a true scoliosis and it progresses, it can actually get quite severe. If you look at this patient on the left with this big rib hump, right, do you think any massage or any spinal manipulation, any exercise, any physiotherapy is going to help this patient return to normal, as in to straighten the spine? No. Any of that treatment is not going to help. This is a very severe case. And if you look at this lady, this is an elderly lady. She is sort of leaning to one side. She has very severe degenerative scoliosis because of all the wear and tear, and her disc is also probably collapsed already. So this patient could be in a lot of pain, and her quality of life will not be very good. On the right side is a young child, 18 months old. She has a significant deformity in her rib cage and her spine due to the rapid growth of her spine. Now, regardless of what caused the scoliosis, once the deformity of the scoliosis is more than 20 degrees, the curve is more than 20 degrees, then we have this principle that kicks in, Porter-Volkmann principle, which actually makes the spine worse and makes the scoliosis more and more serious. So basically what happens is, as the scoliosis develop, right, you have the inside part and then the outer part. And what you see here is that on the inner part, right, there is more compression of the disc and the ligaments and the bones, and then on the outer part, that is what we call decompression. There's less pressure on the outer part. This means that the outer part can actually grow faster, and then the inner part grows slower. So what happens is the scoliosis get worse, and then the curve will actually progress and become more serious. So for effective treatment, right, we need to treat the patient early, because we need to try and reverse the alignment of this scoliosis. so that it does not become worse and worse. Then it will be more difficult to treat. Now, it is important to understand, even for scoliosis cases that have no pain, that actually there is a limited window of opportunity for effective treatment. The period of maximum risk, right, for teenagers and children with scoliosis, the girls is between 10 to 12 years, and then boys is between 11 to 13 years. So if you look at the graph, right, the peak time for the scoliosis to progress is when the children have this massive, very fast growth spurt. So for example, in this graph, like if you wait until they are 15 years old, the spine is actually not developing so fast. It is actually tapering off and slowing down already. So if you treat here, it's actually a bit too late already. It's better to treat the patient here before they have the growth spurt and before the scoliosis actually worsen very rapidly. And people have done research studies, like for example this systemic review of the scientific literature. That means they look at all the scientific evidence in the literature. This was done by this company, the Spinecare, and led by this doctor called Jeb McAvenny. So he's a colleague of mine and I know him personally. And what they concluded was that spinal manipulation is not evidence as an effective treatment for stabilizing nor correcting scoliosis. So this kind of treatment should not be recommended over treatments that have evidence, such as scoliosis bracing and scoliosis specific rehabilitation programs, particularly when the patient have a high risk of progression. Bracing avoids surgery for young patients with scoliosis. This is a research done by this Professor Stewart, and their conclusion is that scoliosis bracing is effective in treating scoliosis. If you want to read the whole article, you feel free to pause the video. Another article, this research is published and done by 25 hospitals in Canada and the United States, and their conclusion is that the rate of treatment success was 72% after bracing, and the research was actually stopped early because they find that the bracing was so effective in treating scoliosis. Now the challenge that people face now is that a good outcome with the traditional Boston types of brace, it actually relies heavily on the skill of the person making the brace, and you find that the brace is not very effective in treating large and severe and stiff scoliosis. The traditional braces are also very difficult for the patients to wear, so if they don't want to wear it because it's hard to wear, then compliance is affected and the chances of success will be less. You can see here the traditional brace is actually symmetrical between left and right. So in other words, it's just supporting the scoliosis in place. It's not actually correcting the alignment of the curve. Think of it like treating a fracture. And you can see this picture here, it opens at the back, so it can be difficult for the patients to wear and to take off. Obviously, it's made using the old technology, so it's not using the modern 3-dimensional technology. Modern braces are using 3D technology that is customized to the specific alignment of the scoliosis and the patient's body. Traditional braces are made mostly using inconsistent approaches, and this results in high degree of variability and the quality of the bracing also. You can see one example here where this girl was given a traditional brace and it's just holding the scoliosis in place. It's not actually realigning the curve at all. This approach actually has no chance of success at all. There is a research published in 2007, and what they find is that with the traditional types of braces, the participants actually resulted in 79% where they had to progress and go and do surgery. But with the previous articles that I mentioned, braces do work. It's just that it has to be done using a modern technology. Here you can see a not very common case where this is a young adult patient before treatment. It's 44 degrees of of curve. And because her spine is already mature, you don't expect a big improvement from this kind of cases, but she was prescribed with a Scoli brace, which is made using a modern 3D technology and is not symmetrical. This is customized to her scoliosis, and you can see after 12 months the significant improvement in her posture and also in the alignment of her curve, 44 degrees down to 29 degrees. Another research done by researchers from Italy, and what they found was 71% of patients actually improve, those that have scoliosis bracing. So of all the research articles that have been covered, one said it was not successful, bracing was not successful, 79% progressed to surgery. And then the other two was in favor of scoliosis bracing. So there is a bit of a contradiction there. But I think this article from the Bone and Joint Journal sums it up. Basically, they have the conclusion that if a brace does not correct a curve on application, that means if the brace does not realign the scoliosis and reduce the curve when the person wears the brace, then either the brace has not been designed or made properly or fitted correctly, or the curve has been too serious that bracing does not work at all. And this is one example. Another one where the patient's posture is like this and the traditional brace is just holding the scoliosis in place. It does not correct the curve at all. Again, this approach to bracing has no chance of success. So compared to on the left here, this is again the traditional type of brace. You can see the modern brace made using 3D technology is not symmetrical and is customized to correct the alignment of the scoliosis when the patient actually wears the brace. Here you can see this patient being prescribed with the Scoli brace, which is the modern brace. You can see the progression of her posture, the improvement in her posture over 3 months, 6 months and 12 months wearing the modern brace. And you can see her x-rays. This is 71.4 degrees of scoliosis, so this is a very severe case. And oftentimes patients will ask us also, like, what if we take off the brace? Will the spine be stable or will the scoliosis come back? So in the middle x-ray here is the same girl. She already finished the 2 years of wearing the scoliosis brace and finished wearing the brace for 6 months already. And you can see the curve is now from 71.4 to 53 degrees. And then 2 years later, her curve remained 53 degrees even though she did not wear her brace anymore. So the curve, once it's stabilized and treated correctly, it can be stable for a long term. As I mentioned just now, not all braces are the same. So you can see this boy here, his scoliosis is 32 degrees at the top, 27 degrees at the bottom, and he was made a traditional brace from the hospital. And you can see when they x-ray this boy with the brace on, the curve from the top reduced from 32 to 21 degrees, but there is no correction at all in the lower part of the curve. It's still 27 degrees, sorry. And then you can see, you compare the boy now wearing a modern brace done using 3D technology, and you can see immediately the change in the result. The lower back curve from 27 degrees has gone to 3 degrees, and then the curve from 21 degrees at the top now is 13 degrees, a dramatic difference. After 3 years of wearing the brace, you can see on the left x-ray, the boy's scoliosis is now only 14 degrees at the top and 15 degrees at the bottom. And when he is wearing the brace, the curve after 3 years reduced to 12 degrees at the top and 2 degrees at the bottom. So this is the boy. Another common questions that patients will often ask is, will the child be very comfortable when wearing the brace? So you can watch this boy here.
Stand up and run around.
Just take it easy.
Not too fast.
Okay, stop.
Red light.
Come back over here. Star jumps. And push-ups.
That's
Could
right.
you do the
Your
before?
knees.
You couldn't do the before either, could you?
No.
That's what I was trying to show him outside. Come
Knee,
on.
put on your knees.
Cool. All right, give us a thumbs up.
That's
Hey,
it.
there
Now
you
straight.
go.
Good.
Good
One
start.
more.
One more.
That's it. Keep your arms straight.
All right, Tamana, come back up. Thumbs up. Cool.
So as you can see, the boy can still run around, can sit and can stand up on his own, can even do push-ups. So as parents, you don't have to worry about the brace being not uncomfortable. They can still lead a very normal life. In terms of the way we categorize on how to brace the patient, basically the curves that are less than 10 degrees, we consider it to be technically not a scoliosis, so we just observe. The curves between 10 to 25 degrees, there is the option to prescribe a brace for night time only, so the patient wear it when they sleep only. And then from 20 to 30 degrees, you can wear the brace part-time. And then when we get down to the more serious curves between 30 to 60 degrees, then the patient will have to wear the brace full-time. And anything above that, we will normally refer for a surgical opinion. This is another case study. This is a 13-year-old girl. You can see that she has a shift in her posture quite obviously to the left. When she do the forward bend Adams test, you can see there's a bit of a hump over here. And on the side profile, you can see there's a curve in her lower back. From the x-ray, you can see the tilting to the left, and her curve is 33 degrees in this case. This is before doing any bracing. And here she is prescribed with a Scoli brace, and 1 month wearing the brace and taking the x-ray, you can see that the curve is now 13 degrees while she is wearing the brace. So you compare before treatment, 33 degrees, still wearing the brace, it's now 13 degrees after 1 month. Now this is 3 months after when she first started wearing the brace. You can see the dramatic change in her posture compared to before she actually started treatment. And her curve has actually reduced from 33 degrees to 26 degrees. This x-ray is taken not wearing the brace. And then after 1 year, you can see there's a dramatic change in her posture. Her posture is almost normal, like it's already returned to the midline, and her x-ray not wearing any brace at all is only 11 degrees. This is almost no scoliosis already. So compare 33 degrees to 11 degrees after 1 year. After 1 year, her doctor actually decided to make a second brace to increase the correction some more, and also to take the fact that her body shape and posture is so much different from her original posture when she started. So they decided to make another brace, and you can see with the second brace, her spine is almost pretty much straight. So you can see her progress over time. Isn't it dramatic from the left to the right? And you compare the x-rays from the left to the right. This is 33 degrees before treatment. This is 1 year later, and this is 22 months out of the brace. So now the curve is only 6 degrees. This is almost perfect already. Another case, this is a 12-year-old girl. She has two curves, so one at the top, one at the bottom. The top one is 43 degrees and the bottom one is at 43 degrees as well. So again, this is a more severe case, and the main worry for this girl is that you can look at her waist. She knows that there is not balance between the left and the right. That's why she wanted to fix the scoliosis. And you can see 1 month wearing the Scoli brace, you can see that the lower part of the curve is quite straight already, and there's also a significant reduction in the curve in the upper part of the spine. This is one of the ways we can do scoliosis rehabilitation. So for this girl, she not only required to do the bracing, but she also was recommended to do the specific scoliosis exercise rehabilitation to further improve the alignment of her scoliosis. So we use specialized scoliosis pillows like this, And just to give you a quick demo of the exercise that they have to do.
Okay, again, lift the leg. Make circles with your leg, big circles. Okay, and put the leg back down, relax. Lift the leg. Keep the leg up, bend the knee up, bring it to your chest. And then straighten the leg back out. Bend. And back out. And bend. And back out. And put the leg down. And lift the leg and hold. And put it back down.
So, in Spinecare, we also offer this kind of scoliosis rehabilitation. If you have any questions, feel free to contact us to inquire more. And you can see this girl after 4 months of doing the bracing and also the rehabilitation, how her posture has changed. And on the x-rays, the curve in the lower back, 43 degrees now, is almost very straight already. At the top here, she still have about 26 degrees compared to 43 degrees at the start. And after 26 months of wearing the bracing and doing the rehabilitation, again you can see the dramatic improvement in her posture. Now, because her skeleton is not very mature already and she's not growing so much already, they decided to switch her to just wearing part-time, only wearing at night only. And after 26 months, look at the dramatic change in the spine. This is just fantastic correction of the scoliosis. This is the girl 34 months later. You can see how much her scoliosis has improved, and also you can see how dramatic the posture. Now her posture is pretty much back to normal already. This is a very fantastic result for this patient. If you look at her x-rays after 34 months, so remember at 34 months she is only wearing the brace part-time at night, and you can still see that even though she has switched from wearing the brace full-time to part-time, the 43 degrees in the lower back has almost remained the same, so it has been practically zero. And then her 43 degrees when she started on the upper part of the spine, the 26 degree improvement has maintained. So even though she has been wearing it part-time now, the curve has maintained and remained stable. For this patient, after 34 months, she was able to complete the treatment and eventually stop wearing the brace. So I hope you have enjoyed this presentation today and you have a better understanding of how to assess the scoliosis patients and how to diagnose the scoliosis patients, and most importantly, giving the right advice for scoliosis patients. Actually, many of these patients have a very limited window of opportunity to have a successful treatment, especially adolescent children that are going through a very fast growth spurt, or even middle-aged to elderly adults that have early onset of degeneration in their spine. Some of these patients, if they are not given the proper advice and proper treatment at the right time, they will actually have lifelong issues to deal with. So I thank you for your attention. I hope this has been beneficial for you. If you have any questions about the scoliosis treatment, such as the modern bracing that we use, or even if you will require testimonials of our patients, we have treated patients from Malaysia and also Indonesia. So if you have any questions about anything at all, please feel free to contact us and we will be very happy to answer your questions. Thanks for your attention again. Bye bye.